So besides vomiting, the other end of the child's gastrointestinal tract causes at least equal anxiety to the parent. And what we're talking about right now is diarrhea. So what is the definition of diarrhea? Diarrhea is really kind of loose or watery stools. Now, most of the time, if your child has diarrhea, the vast majority of the time, just as with vomiting, it's going to be benign. It's going to go away. It's not going to be serious. And a lot of times it's caused by viruses. Again, short period of time, it's going to go away on its own without any treatment, caused by viruses. Now, occasionally, this can be serious. Diarrhea once in a while can be something serious. So what should you look for? If your child is having diarrhea that's black in color, that is associated with blood in any way, is associated with fever, or persists for more than 1 day, you probably should contact either your pediatrician or bring the child to the emergency room. Those are the things to look for. So black in color, blood, fever, or if it's going on for an extended period of time, or if your child has any signs of dehydration,
right,
that would be a reason to seek medical attention immediately.
The main thing with diarrhea, again, is that you don't want fluid going out of your baby. You want them to stay hydrated. And if they're having diarrheal stools enough that you carry extra clothing for them and for you, in addition to all the extra things you keep in the diaper bag, they may be losing enough fluid that dehydration is the biggest concern. You want to give them fluids that keep them hydrated. So you can buy over-the-counter things that include things like Pedialyte, Infancy, that have the chemicals. They have a little sugar, they have a little bit of minerals, things like salt, that are in the right balance to help keep your child well hydrated. That's important to do. However, milk-based formulas may not be such a good idea, and that's something where you really want to call your pediatrician. If there's any question where milk might be an issue, give your pediatrician a call. Some pediatricians feel very strongly about this, one way or the other, and they'll want to talk to you about the idea whether milk-based formulas, if that's what you're giving your baby, are something you might want to stop at least temporarily. We don't give medications to stop diarrhea in children. I know adults often will run to the drugstore and pick up something to help the diarrhea that they have. We don't recommend them in children.
Especially young children.
It's problematic. Dosing is an issue, and the way that these medicines work, it can cause some significant side effects in little tiny kids. So we just don't recommend using them at all in children. And again, the most important thing is to match what's coming out with something going in to keep them well hydrated. So that's sort of what you want to aim for.
As long as more stays in than comes out, and you look for the signs that things like child urinating, tearing, those are good signs that your child is still very well hydrated. Exactly.
And by the way, if your child is eating solid food, feed them.
Yes.
Okay? Go ahead and feed them. And in fact, there's some evidence that says they will get better faster. So don't stop giving them solid food. Again, if it's vomiting's one thing, but if it's diarrhea, that's okay. Feed them what goes in the top. Make sure there's plenty of fluids coming in as well. What's coming out the bottom will get better relatively quickly as long as it's a viral cause.
Exactly.